In this video series, I'm going over the things that drive me nuts about conventional medical care. And today we are talking about thyroid testing. Now, how many people watching this video have been struggling with low thyroid symptoms? And you guys know what these are. This is the low energy, weight gain, fatigue, dry hair, dry skin, constipation, mood changes. And you probably went to your conventionally trained doctor and asked to have your thyroid checked. And the doctor agreed and measured a TSH and came back to you sometime later saying, your TSH is normal, you're not hypothyroid, have a good day. Here's an antidepressant, here's a stimulant, here's some other kind of drug. I'm making this video to remind you guys that a TSH is not an adequate way to fully comprehend and measure your thyroid function. Remember, the TSH is a hormone that is released by the hypothalamus and the pituitary to instruct the thyroid gland on how much thyroid hormone to make. But this doesn't measure what is going on at the tissue level. It's not showing us how much of the active free T3 is available to bind within the nucleus of the cells and increase the cell's metabolism, which is what thyroid hormone does. Now, what I want to do is show you guys an actual laboratory test where if all you looked at was the TSH, you would say this is fully normal. You can see that the TSH is around 2.5, and most conventional labs assign a range of 0.5 to 5 as normal for TSH. So this would fall smack dab within the normal range. Now, ZRT Labs, who did this test, has actually drawn back the upper level of normal, which I think is appropriate. But either way, you would say that this is a normal TSH. But when you look at the free hormones, you can see that the free T4 is barely in range, and the active free T3 is actually out of range. So if all you measured was the TSH, you would say that this is normal thyroid function, and you wouldn't have the insight that this test gives when you actually measure the free hormones as well. So what to do? The first thing to do is to remember that the best way to measure your thyroid function is to measure a TSH. Sure, that's a good start. But also be sure to measure a free T3 and a free T4. And I'd recommend to everybody watching this video at least once in your life, be sure to make the measurements for Hashimoto's thyroiditis. And this is a TPO and a TG antibodies, because something like 1 in 10 Americans actually has some evidence of antibodies to their thyroid gland. And it's important to know this because when you know it, you can begin to take the steps to turn it around. So there you have it. That is the best way to measure your thyroid function. But if you really also want to know about where you stand on this functional disease to health spectrum, what I've done is created a really simple 5-question at-home survey that will give you some insight into your state of health, and you can access that by looking in the description below, clicking on this and taking the survey. It'll take you a couple minutes and give you some good insight. And as always, I'm making these videos for you guys because I believe that the future of medicine is in individuals like you learning to care for themselves without using drugs. And you know this spiel. I'll see you guys in another video, and take care.